So Botox is actually not botulism. The idea for Botox does derive from the fact that there's a poison known as botulism out there, but what some very bright scientists did is decide to take the active component of the toxin from botulism itself and recreate it in a laboratory. In doing so, we now have a way to relax muscles with almost pinpoint accuracy and really help someone to look much more refreshed and rejuvenated. The procedures are relatively simple. Injections are really not a big deal. And if you have someone injecting you that is skillful enough, there's no reason that you can't get a nice refreshed look after having some Botox done. The way Botox works is that it interrupts your nerve's ability to stimulate a muscle. So it doesn't actually affect the muscle itself, it doesn't actually affect the nerve itself. It's the connection between the two that is interrupted. And that's how we prevent the muscle from twitching despite the fact that the nerve is sending signals for that to happen. If we can prevent the muscle from twitching for more than 18 months, there's a little bit of muscle atrophy that begins to set in. What I'm getting at is if a patient stays pretty religiously with their Botox treatments and they don't allow that muscle to become innervated by the nerve that is sending the signals, the muscle itself will begin to atrophy, and over time you won't need Botox at all any longer. So for the right application and for the right patients who really don't want, for argument's sake, that straight line that comes up in between the eyes there, they call it the 11 sign, we probably can prevent that from happening just about forever in a patient who comes in on a regular basis.